Good evening, everyone. Thank you for joining us this evening for our Ask a Dietitian webinar. My name is Dianne Dobson. I'm one of the nurses at Pancreatic Cancer UK working on our support service. It's a pleasure to welcome you here this evening. We speak to around 2,000 people affected by pancreatic cancer each year on our support line. Many, if not most of them, have issues or questions around diet, digestion and pancreatic enzyme replacement therapy, such as Creon. I'm delighted today to be joined by two of our specialist dietitians, Rachel and Lauren, who will be discussing some of these topics throughout this evening, and then you'll have the opportunity to ask questions. So before we get started, we just have a few housekeeping things that we need to run through. So for housekeeping, there'll be a question and answer session at the end of the webinar. You'll be able to see the Q&A icon on the screen at the moment on the right-hand side, which looks like two speech bubbles. If you just type a question into the box, then you'll be able to hear these questions at the end. There's no need to wait until the end. So if you have a question as the dietitians are talking, please feel free to add that. Be aware that any of the questions you type into the box will be visible by all attendees. You can choose to ask a question anonymously if you prefer, or you can upvote questions by clicking on the thumbs up button. This will boost them to the top of the list. There may be questions that are highly specific or fall outside of the scope of this evening's webinar. So that we can keep the questions we answer relevant to as many people as possible, we may in these cases reply in the question and answer box, offering signposts to support and information, or encouraging you to recall the support line rather than reading your question aloud. I'm aware that we might have some overseas attendees attending this evening. If you are joining from outside the UK, you're very welcome and thank you for coming along. Please keep in mind that the information we share is based on the UK healthcare system, so it might not be entirely relevant to wherever you're living. We also have some health professionals joining. Again, you're very welcome and thank you for coming along this evening. This webinar really is for those people with a personal connection to pancreatic cancer, so please be mindful of this when you're asking questions. And the webinar is being recorded and will be made available on our website afterwards if you'd like to watch it back or share with other people who might be interested. Before I introduce our dietitians, I would like to just give a brief overview of some of the support that we actually have for people. So hopefully if you bear with me while I do a little bit of a whistle-top tour. First of all, I'd like to talk about our support line. Our support line is a service that's open to anyone affected by pancreatic cancer. This is a confidential service and you can be in touch with us as often as you need. There are 7 nurses on this service and we aim to keep continuity as much as possible so that you get to speak to the same nurse. You can access this service by phone or email, and our remit is that we'd always respond to emails within 24 hours. We also offer to send information via email after a long phone call because we appreciate that you're not always able to remember all of that information. We provide information and questions about all aspects relating to pancreatic cancer. This might be managing appointments, speaking to your local teams, knowing what to expect from appointments, sometimes managing symptoms and discussing your treatment options. Of course, we always realise that people don't necessarily have a question. Sometimes they're just after a listening ear and someone to give them some emotional support. This service is free. Our support line hours are on the top of your page. I would also say that most people don't realise that our phone is actually answered by a nurse, so you're not having to go through a receptionist or talk to someone else before you speak to the nurse. Next slide, please. We have a lot of information available to anyone affected by pancreatic cancer. We have a great team here at Pancreatic Cancer UK who provide our information. It's peer reviewed by people living with pancreatic cancer and their family members, and also by experts in pancreatic cancer, so health professionals practicing. Our information is quite accessible. It can be read online, it can be downloaded. We're able to post our booklets to anyone who wants a hard copy, and this is all free of charge. We also have different formats such as easy read, braille, large print and videos. We have a newly diagnosed pack that's available for anyone who is newly diagnosed. And this has the key brochures in it that you might be needing. Of course, if anyone finds searching for information too overwhelming, they're more than welcome to give us a call, and we can actually email things that might be most relevant for you as well. Next slide, please. We have some online support sessions. If anyone is new to these, they're really popular. So along with many other things, the impact of COVID, we started to run some virtual support sessions, and these are accessible via Zoom. They're a really good opportunity for people to meet other people affected by pancreatic cancer, and it's of course all done from your own home. We've had great experience of someone listening into this while they were actually having their chemo in the oncology unit, so it just goes to show how versatile these sessions are. Each session's different. We have a different nurse facilitating them and different topics. Some of these are managing nutrition and pancreatic enzymes, chemotherapy, managing symptoms, and one of our very popular sessions is something called Carers Cuppa. The great news is that we're also planning a cuppa for those people affected by pancreatic cancer. So this is new, and this will be starting in November on Tuesday the 23rd. And finally, something about our discussion forum. So our discussion forum's an ever-evolving page. This is a really welcoming community for anyone affected by pancreatic cancer. You can actually read this online. It's on the World Wide Web, so it's not a locked page. If you're wishing to post questions or comment, you do have to register and use an anonymised username just to protect yourself. There's a very good forum family that are very welcoming and always welcome new people to the forum. And last slide. Certainly last but not least, we have a wonderful peer support service called Side by Side. This is a service available for people either waiting to have surgery or who have had surgery. And you're able to speak to a volunteer who's also had surgery. This is very helpful, it's very supportive for people, and it's quite a flexible service. You can speak to people outside of normal working hours, so that could be in evenings or weekends. We're grateful to our side-by-side volunteers. They provide an amazing service. If anyone's unsure about the services or what might be suitable for them, please feel free to give us a call on the support line. We can direct you, we can put you in touch with a side-by-side volunteer if that's appropriate, and help you work through any of that. Without further ado, I'd like to move on to our dietitians, because that's really what we're here for tonight. I'd actually like to hand over to Rachel, who will start the presentation this evening.
Hi there, I hope everyone can hear me okay? So, hi, my name is Rachel. I'm a dietitian and I work at the Royal Hospital in Liverpool. Lauren works as a specialist oncology dietitian, and we're going to share the presentation today. So what we'll go through today is the role of the dietitian, what the pancreas does, the impact of pancreatic cancer, pancreatic enzyme replacement therapy, type 3C diabetes, and then Lauren and myself will both cover some eating and pancreatic cancer, treatment side effects, and Lauren will do the myth busting section as well. So as dietitians, we are qualified to assess, diagnose and treat dietary and nutritional problems at a wider and individual health level. We are regulated by the Health and Care Professions Council. So it'd be interesting to know, have you or your loved one been able to speak to a dietitian following the diagnosis of pancreatic cancer? You should see a poll on your screen now and you can answer that. And we'll give you 15 seconds or so just to answer for you. So have you or your loved one been able to speak with a dietitian following the diagnosis of pancreatic cancer? So it looks like a 50-50 split, and then a few people are still waiting. It can be really tough to see a dietitian. You know, you might not have been referred, you may not have been able to see them yet, or you may have been lucky enough to see one. But hopefully what we'll cover in the session today is the things that I will speak with the people that I see who do have pancreatic cancer. So hopefully you can find it really useful. So as a dietitian, what I'm aiming to do is work with the person I'm seeing to help build as much strength as possible. And we call this building nutritional status. And that is getting somebody as strong as possible. And this could be for their upcoming treatment, which would be either could be either surgery or chemotherapy or both. But building strength is also really important to help improve quality of life. So this is the pancreas here. So it's an organ that sits behind your stomach, and it's got two really important jobs. One of those is to help with our digestion, and another is to help with our blood glucose levels. In terms of our digestion, when we eat foods, three of the main foods that we eat are macronutrients. And these are the things that we eat in large amounts to give us energy and fuel. So carbohydrates, these will provide us with energy, and they're found in foods such as bread, rice, pasta, bread products like naan or chapati, and potatoes. Protein foods are the foods that will help to build strength, so build muscle, and they can also help with wound healing. So for example, following a surgery. So protein foods are found in meat, fish, eggs, nuts, tofu, beans, pulses, and also in dairy foods, so things like milk, yogurt, and cheese. And then the final macronutrient that we'll talk about is fat. So fat is really, really helpful. It's got lots and lots of calories, which is really important when we're trying to build somebody's strength. It also helps with the absorption of some of our vitamins, and it helps food to taste really good. So we have unsaturated fats, which is found in things like olive oil, nuts, oily fish, and avocados. And then we have our saturated fats found in things like cheese, butter, cakes, and biscuits. So when we eat any of these foods, it will travel down the esophagus, that pipe there, from our mouth through to our stomach. Then from the stomach, thank you. Then from the stomach, the food will move through into the top part of the small bowel. This is the duodenum. The pancreas, if you can move on, Lauren. The pancreas also joins there onto the duodenum. And when we eat any foods, the pancreas makes something called enzymes. If you could move on. So the enzymes are made in the pancreas, and they will travel down this main pancreatic duct that runs down the middle of the pancreas. And those enzymes are then released into the top part of the small bowel, the duodenum here, to mix with our food. And enzymes are really important in breaking our food down into small enough pieces so the rest of our bowel can absorb all of the nutrients that we've eaten. Once the absorption of that food has happened, then our body can use our fuel, the nutrients that we've eaten, as fuel. Can you move on, Lauren? So different enzymes will work on different macronutrients to help break them down. So amylase will work on our carbohydrates, protease will work on our proteins, and lipase will work on breaking down our fats. Fats need a little bit of extra help, so bile is also used to help break down our fat. And these enzymes, like I say, will break those foods down into small enough pieces so the bowel can absorb those nutrients, and then it can be used as fuel, and that's absorption. But what we can see in pancreatic cancer is that sometimes there isn't enough enzymes made, maybe due to damage to the cells, or there is a blockage, so the enzymes can't get to where they need to go. So, for example, a tumor. So rather than the enzymes being able to mix with the food in the top part of the bowel, the duodenum, what we can see is, in fact, there isn't enough enzymes made, or they can't get there. So the food is unable to be broken down, and the nutrients are not able to be absorbed. And we call this malabsorption. So symptoms of malabsorption that we often see are greasy, oily, pale stools, very yellow. They can be very difficult to flush away and be very smelly. Abdominal discomfort, pain on eating, urgency, so having to run to the loo, especially after you've just eaten, and ongoing weight loss. And what we can see when somebody is malabsorbing, this can very quickly lead to malnutrition. So when somebody is malabsorbing, remember, if they're not able to absorb those nutrients because the pieces are now too large, then rather than the nutrients that we're eating being used as fuel, the body has to almost turn to itself to provide fuel. So it can it can use our fat stores and our muscle stores, so to provide fat and protein to have some fuel. And then what we can see when the body's almost using its own sources of protein and fat is that we get very, very quick weight loss. And we see this very often in pancreatic cancer. So when someone's losing weight or lost a lot of weight, what I really mean is they're losing a lot of strength. And that's because of the muscle that's no longer there because it's being used as fuel. And with this strength loss, what we can see is people become very weak, they get fatigued very, very easily, and their immune system isn't as good, so they can pick up infections more easily, and overall it has a huge impact on quality of life. We also know if someone's malnourished, they might not tolerate their treatments as well as somebody who is well nourished. So they may not tolerate their chemotherapy quite as well. And if somebody is malnourished going into a surgery, then it can take them longer to recover afterwards, and it can take them longer to be discharged home following that surgery. Anybody can be malnourished. So if somebody's had a significant portion of weight loss in a very short period of time, so within a matter of weeks, then even if they sit on the healthy or even the overweight section of our charts, they can still be malnourished if they've lost a significant portion of weight in a few weeks. We say significant would normally be 10% of your normal weight. So if you've lost a decent portion of weight, it's really important to see if you could either be referred to a dietitian or use the information from this session today. So what I'm aiming to do as a dietitian is to try and slow or stop that malnutrition and reverse it if possible. And the way that I would do this is by speaking with people with pancreatic cancer about how to eat and drink well with pancreatic cancer, but also about how to ensure that they're taking one of their medications properly. And this is pancreatic enzyme replacement therapy. So pancreatic enzyme replacement therapy is a replacement of the enzymes that the pancreas would normally make. So rather than our pancreas working to create enzymes and those working to help break down our food properly, the PERT capsules, the pancreatic enzyme replacement therapy, are those enzymes just in a tablet that you take whenever you would eat some food. So it'd be interesting to know how many, Lauren, if you could move on. Are you or your loved one taking pancreatic enzyme replacement therapy, such as Creon or Nutrizyme? Again, you should see one of the polls up, so I'll just give you a few more seconds to answer. And we can see how many are taking your PERT capsules. So that's really good, actually. So that's a really, really impressive number of people who are attending that are taking pancreatic enzyme replacement therapy. There's still a few who are not as yet, and some who aren't sure. The guidelines recommend that anybody with a diagnosis of pancreatic cancer should be taking pancreatic enzyme replacement therapy. So if you are not taking it, or you've been unaware that maybe you could have been offered this, then I would speak with either your specialist nurse or your GP to see if you can get a prescription of pancreatic enzyme replacement therapy. And the reason that we want people to be taking their PERT capsules is it can lead to an enhanced quality of life, have improved overall survival, obtain a better symptom score, and you may tolerate your treatment better. And we know that when taken correctly, PERT will aid adequate absorption of your nutrients, reduce symptoms of malabsorption, can lead to formed normal coloured stools again. It can lead to weight maintenance and even weight regain, and overall lead to improved quality of life. So PERT capsules should be taken with every meal, every snack, any drinks that are nourishing. And our starting dose would usually be 2 to 3 25,000 unit capsules of PERT with a meal, and 1 to 2 25,000 unit capsules with a snack or a nourishing drink. We would count a nourishing drink as something like a hot chocolate or a milkshake or a cappuccino. Anything that's made with more than half milk, that would count as a nourishing drink. Also any nutritional supplement drinks, so Build Up or Ensure or 46, they would all require PERT capsules. And the best way to take PERT is always swallow it with a cold drink, never a hot one. Ideally swallow it whole if you can. If you're taking more than one capsule, then ideally spread it throughout the meal. So if somebody is taking 3 capsules with their meal, I would normally suggest taking 2 at the beginning and then 1 halfway through. If you're unable to swallow the tablets whole, because they are quite large, what you can do is actually open the capsules, and those tiny balls and microspheres inside of your capsules, they can be mixed with something acidic. And that something acidic would be a spoon of yogurt or a spoon of fruit puree, like an apple sauce or a tomato sauce. So mix the balls with your spoonful of acidic, and then take it as you would take your capsules. So take a couple of spoons right at the start, and then another halfway through with all of your microspheres. If you are doing this, it's really important to rinse your mouth really well afterwards, okay? If you get any of those tiny balls stuck on the inside of your mouth, it can cause some irritation. So rinse your mouth really well with water. Ideally store at less than 25 degrees. Not an issue at the minute, but when it's warm, make sure they're not sat in direct sunlight on windowsills, make sure they're not in good compartments in the summer. Make sure that they are not loose in your pockets, which ideally be in a pill box if possible. Don't open your capsules and sprinkle onto food other than the acidic, something that we mentioned previously. So don't open it onto your fish and chips, because it'll make your fish and chips taste horrible, but it also stops those enzymes working properly. If they get too hot, then they don't work as well. So don't open the sprinkle directly onto food. If somebody is taking their enzyme capsules, but they're still getting symptoms of malabsorption, the first thing we do is check if the dose is correct. And if someone's still getting those symptoms of malabsorption that we've previously talked about, what I'd normally suggest is increasing that dose of their PERT capsules by 1 to 2 capsules per meal, per snack, per nourishing drink, to increase the amount of PERT that they're getting and hopefully get to the point where there's no longer any symptoms of malabsorption. If we've been ramping up the dose of the PERT, but there are still some symptoms of malabsorption, we also check if the person's taking a PPI. So a PPI is a medication, a proton pump inhibitor, and this helps to manage the acidity level in the stomach, which can make the PERT tablets work better. So you might be taking a PPI. The common ones are omeprazole or lansoprazole. If you're not taking this, but you are taking PERT, I'd probably speak with your GP and see whether it'd be appropriate to be started on a PPI. So in certain instances, PERT are not needed when we're eating. So if you're having a single portion of fruit or veggies, then you don't need to take any PERT. But if you had something like carrot sticks with hummus, or if you had strawberries and cream, then you would need to take some PERT to help absorb the fat in those additions. If you're having any sugary sweets, so marshmallows, jelly babies, portion of jelly, you don't need to take any PERT with that. Any tea or coffee with a drop of milk in, you don't need to take PERT with that. If your drink that you're having is more than half milk, then that would count as a nourishing drink. So take your snack dose of your PERT with those drinks. Water, squash, fizzy drinks, you don't need to take that. And if you've missed a meal for whatever reason, you don't need to take the PERT, because the PERT just works on the food or the drink that you've had. What I would say is, if you are taking PERT that you've been prescribed 10,000 unit capsules rather than the 25,000 units, this is really increasing your pill burden. So what I would do, so your pill burden is the amount of tablets that you have to take every day. If you're taking the 10,000s, I would probably speak with your GP and see if you can switch to the 25,000s, because it would just be a lot easier if you have to take fewer capsules. So I get lots of questions about PERT. So I've popped a few of the common ones in here, but if you've got any others, just stick them in the Q&A box, and then we'll hopefully get to them at the end. Can I overdose? So if you have a diagnosis of pancreatic cancer and you're taking PERT, then there's no upper limit to the amount that you can take. What we'd want to do is increase the amount of capsules that you're taking to the point where you are no longer getting symptoms of malabsorption. So no, you can't overdose. Should I follow a low-fat diet? I get asked this very often, because when somebody is malabsorbing their macronutrients, when they're malabsorbing fat, we get those quite unpleasant symptoms of malabsorption. So greasy, oily stools that are very difficult to flush away, very smelly. And when people take fat out of their diet, they no longer get these really unpleasant symptoms. But we know if someone's malabsorbing one of the macronutrients, they're also going to be malabsorbing the other. So if you're malabsorbing fat, you're also malabsorbing carbohydrates and your proteins. So rather than following a low-fat diet, what we actually want is you to be following a diet that has plenty of fat in it, because it's got lots of calories, helps food to taste really good, and match your PERT dose with what you're eating to stop those malabsorption symptoms. If I don't snack, I wouldn't have to take as many. I mean, absolutely, yeah, if somebody's not eating, they don't need to take PERT. But what we want is to build as much strength as possible, because we know if someone's well nourished going into treatment, then this can really help them to tolerate it better. And we know if someone's well nourished, they have an improved quality of life. So rather than avoiding snacking so you don't have to take your PERT capsules, what we recommend is snacking as often as you can to get that calories in, get the energy in, to get that strength built up. Does PERT contain animal products? Yeah, PERT are made using pork products. So if someone chooses not to eat pork as part of their daily diet, so if you're vegetarian or vegan, then it's a discussion of pros and cons of taking or not taking the PERT capsules. The capsules that you may be able to buy on the high street are not effective. They don't work in the best way. We know that the PERT capsules that are prescribed are effective in helping you to absorb the nutrients. So it's often a discussion of pros versus cons. If somebody doesn't eat pork as part of their religion, then because PERT is a essential medication, this is allowed within the religion. But what I do normally suggest is speaking with your religious leader to talk it out with them. I don't have symptoms of malabsorption. Do I still need PERT? The pancreas is great in that it works very hard, and often we don't see the symptoms of malabsorption up down to only to the point where there's only about 10% of your capacity of the pancreas left. So what we do know is if somebody does have pancreatic cancer, they're likely to be malabsorbing to some degree, but we're just not seeing those symptoms yet. So if you've been prescribed PERT, but you don't have any symptoms, I would continue to take it for sure, because what we want to do is make sure that you are not becoming malnourished, because that can affect how well you're tolerating your treatment. I forgot PERT with my meal. Should I take it now? I would normally say it depends on how long after. If it's anything longer than about 20 to 30 minutes, then I'd say don't worry this time. But what can you do next time to remember? So if you eat your tea in front of the telly, could you put your PERT in front of the TV? Or could you ask somebody to remind you, a quick text message, a phone call, or a loved one at the table eating with you, reminding you? Or could you put them next to the salt and pepper? What can you do next time to make sure that you're taking your PERT regularly? Because taking the PERT is going to help with your absorption, help to build up your strength, and that's what we want at this stage. So another important job of the pancreas is to help manage our blood sugar levels, and it does this by producing hormones, one of which you will probably have heard of, which is insulin. So whenever we eat any foods, the macronutrients, when they're broken down and absorbed, because we're taking our PERT in the best way, when they're absorbed by the small bowel, they go into the bloodstream and it increases our blood sugar levels. And that's completely normal. And then the insulin, which is made in the pancreas, will come along and act almost like a key. And what it does is when the energy that has been absorbed from our bowel is in our blood, the insulin will open the cells and act like a key to allow that energy into our cells to then be used as fuel. But what we can see is if somebody's pancreas isn't working in the best way, so if there's been some damage to those cells, so it's not making enough insulin, which we might see in somebody with pancreatic cancer, what we see is there isn't enough insulin made anymore, which means that there isn't enough insulin to open the cells to allow the energy that's in our blood into the cells to be used as fuel. What this leads to is high blood sugar levels. And when it's related to a pancreatic condition like pancreatic cancer, this is called type 3C diabetes. So type 3C diabetes can make malnutrition worse because the energy that's in our blood can't get into our cells to be used properly. So rather than our energy being the food that we're eating being used as fuel, our body again turns to itself to get some fuel. And symptoms of high blood sugar will include frequent urination, especially overnight, extreme thirst, non-healing wounds, recurrent UTIs, and weight loss. If you're getting any of these symptoms, I would speak with your specialist nurse to get your blood sugar levels checked. Be aware as well that starting on PERT might unmask type 3C diabetes. So if somebody is not absorbing their nutrients before they've started on PERT, then their blood sugars levels may be fine. However, once they've started on PERT and they're actually absorbing all their nutrients, what we can see is their sugars are high, and this unmasks the fact that there isn't enough insulin there to help all of that energy into the cells. So if you've just been started on PERT, be aware of those symptoms and again, speak with your specialist nurse. And the management of type 3C diabetes would be medication, either oral or injectable, regular blood glucose level monitoring, potentially some dietary changes, but restriction is inappropriate in people who are malnourished. And medication dose should always be altered to match oral intake. Intake should never be restricted. So if somebody is eating well, what we want to see is that their medication is matched to help manage their blood sugar levels. We don't want somebody being asked to reduce what they're eating, because this goes against what we're trying to do. We're trying to build strength as much as possible. So always have your medication dose matched rather than restricting what you're eating to keep your blood sugar levels under check. And finally, so the aims of what we're doing as a dietitian, again, is to build strength, to help improve quality of life, and to help build strength for upcoming treatments, so chemotherapy and surgery. And in addition to taking PERT correctly, what we do is want people to eat as well as possible. And when somebody has pancreatic cancer, there is no dietary restrictions at all. We want you to be eating anything. And ideally, if we can, eating regularly, so 3 meals a day, a couple of snacks, and a pint of milk daily if you can, because milk's really nourishing. Some choices of foods are more nourishing than others. So if you could just go back again, Lauren, that would be great. Remember, carbohydrates are there for your energy. Protein's there for your strength, so building your muscle back, especially if you've had a lot of muscle loss, and for helping with wound healing. So minimum of 2 to 3 portions a day of your protein foods. Remember, fat adds lots of calories, lots of energy, and is really helpful for making food taste good, so add plenty of fat. And then we can enrich and fortify our foods, which we'll go through on the next slides. And then nutritional supplement drinks can be really, really helpful. So Build Up, Ensures, Fortisips. If you're taking any of these nutrition drinks, they're great because they provide lots of calories, lots of protein. But remember, if you're taking any of those nutrition drinks, if they're either juice-based or milk-based, you must take your PERT with each of those drinks, because you need to be able to absorb all those really good nutrients within the drinks. So enriching food is a process of adding additional calories or energy and protein to get as much goodness into what we're managing to eat as possible. What we're aiming to do is to make the foods that we are managing very nourishing, but not having to increase the volume of the food that you have to eat. So we do this by choosing always full fat options wherever you can. So yogurt, cheese, milk, always go for your full fat options. And can you add calories and protein? So for example, skimmed milk powder into things like porridge, soup, coffee, into puddings, into mashed potatoes, or could you add butter and cheese? So maybe into mash or into soup. Could you add a handful of grated cheese, double cream into things like porridge or rice pudding? Or could you add things like condensed milk, honey, nuts, dried fruit onto things like cereal or yogurt? A lot of the things that you've been told probably not to eat for years and years and years, what we want to do is add these, because we want your food to taste good and have lots of calories and lots of protein. So this is just an example of 2 days worth of food. We have a standard day and an enriched day. So day A is your standard day with your semi-skimmed milk, a couple of biscuits as a snack, tomato soup, evening meal of shepherd's pie with a low-fat yogurt, a quick supper, and then drinks throughout the day. And then day B is your enriched day. So we're not increasing the volume of food, but we're adding in. So whole milk is your full fat option, adding skim milk powder, a bit of double cream, switching out your biscuits for something like 2 crackers with butter and cheese, adding cheese into your tomato soup, adding your mash, adding into your mash that's on your shepherd's pie, so adding cream cheese, some whole milk, some skimmed milk powder again. Choosing a higher protein yogurt rather than a low fat yogurt, and then adding some extra protein onto your supper, so peanut butter and banana on toast, and then choosing more nourishing fluids, so fruit juice, milky coffees, bovril. And what we can see actually is that this will increase the calories, so double the calories and double the amount of protein that you're getting in. And this is what we're aiming for. We're getting all the calories in, all the protein in, to build your strength, to help you to improve quality of life and tolerate your overall treatment better. So I'm going to hand over to Lauren now, who's going to complete the rest of the session.
So I'm Lauren Roberts, and I am an oncology dietitian working specifically with pancreatic cancer at the Clatterbridge Cancer Centre based in Liverpool, and we also have sessions at Wirral and Aintree as well. So whereas Rachel focuses on more of the surgical side, with pancreatic cancer I tend to focus more on the oncology side and the chemotherapy and treatments for pancreatic cancer. So it'd be good to just get your experiences, if that's okay, by doing a little poll. So have you or your loved one with pancreatic cancer had any sort of side effects or difficulties with eating? Give you some time to answer. Okay, interesting. So quite a lot of nausea and sickness, lack of appetite is a big common one there. Feeling full quickly and taste changes. Okay, so it looks like pretty much all of you or your loved ones have experienced at least one side effect there. Okay, thank you. Okay, so you know, the side effects of pancreatic cancer and the effects of cancer treatments can make eating and maintaining weight a very difficult task. And as from that poll, a lot of you have experienced sort of loss of appetite and change in appetite. So where eating, you know, was pleasurable and sort of a nice experience before, many of our patients say that during treatment it can often be more of a chore or a task rather than a pleasurable experience. And cancer itself and the treatment can alter the way that your body uses the food that you eat. So you tend to need a lot more energy and a lot more calories through your diet in the day to keep up and maintain your body weight. We often see patients saying, you know, Eve, I'm eating well, but my weight is still dropping. That can be as a result of the cancer and the treatment. And also, as Rachel's talked about before, can be related to malabsorption and you're not taking enough enzymes or PERT as well. So we know that eating a nutritious diet and being as strong and well nourished as possible during cancer treatment can help. It can help to minimise or prevent any weight loss through treatment. It can minimise delays with treatment as well. We often have to use your body weight and your body surface area to calculate chemotherapy doses. So if there are big drops in weight and big changes there, then it can often delay when you have your treatment. It can help with reducing treatment side effects and also help with quality of life, your well-being and overall survival as well. So, you know, cancer and the cancer treatments affect everybody differently. Not one patient is the same. They can vary. You might get some patients that have a number of side effects and others that have none at all or very little. And, you know, side effects come with all types of pancreatic cancer treatment, whether it be surgery, chemotherapy or radiotherapy. So, you know, surgery for the pancreas is one type of treatment, and it's often used if the pancreatic cancer is caught early, but it also can be used after a period of chemotherapy if that tumour's shrunk enough as well for surgery to go ahead. It's vitally important that you eat well before and after surgery to help with recovery, as Rachel has talked about before, help with tissues and healing, wound healing, help to regain that strength as well that you may have lost, particularly if you're going to go on and have chemotherapy after. And we've just listed some of the side effects that are quite common following surgery. So early satiety and that feeling of constantly feeling full, or being, not eating very much because you're feeling full quickly, fatigue and that exhaustion, taste changes is a common one, reduced appetite, nausea and vomiting, and also diarrhea, and that's diarrhea and those fatty yellow greasy stools, which are signs of malabsorption, are common following surgery as well. Similarly, these side effects come with chemotherapy, but in addition, we often get patients complaining of sort of sore and dry mouth as well. And that's because chemotherapy is obviously entering your whole bloodstream, your body, and it affects healthy cells as well as the cancerous cells. So all of your sort of gastrointestinal tract from mouth to bowels can be affected, whereas with surgery or radiotherapy, it's treatment in sort of one specific area. So we'll talk about some strategies to help manage side effects now from a diet point of view, that I come across quite frequently in clinic. So I won't dwell on this slide too much, because Rachel's already talked a little bit about what you can do for reduced appetite, but it is a very common side effect of treatment, and sometimes it's the first thing or sign that something is wrong, and it might lead to your diagnosis or your loved one's diagnosis. Stress and anxiety can also add to reduced appetite, worrying over what's going to happen, the uncertainty, worrying about chemotherapy or treatment and how you may be from that. So Rachel's talked about food fortification and food enrichment and getting the most calories out of your meals, little and often. So where you may have been a 3 regular meal person before, try and split it down into little and often, 5 to 6 small snacky meals per day. Try not to fill up too much on non-nutritious fluids such as water, fizzy drinks, tea and coffee, and go for the more nourishing options like milky drinks, Horlicks, hot chocolates, nutritional supplement drinks. Choose foods you fancy as much as you can, and also make the most of when you're hungry and have the best appetite. So I had a patient say today, I'm great in the morning, I eat really well in the morning, but as the day goes on, my appetite just peters. So it was about looking at what we can do to maximise her sort of nutritional intake in that morning, in that first part of the day, to make up for sort of the dwindle in appetite and intake as the day goes on. And some people find blander foods are better tolerated as well. So feeling full, so similar advice, so little and often with your food, avoid filling up on fizzy drinks that are quite gassy, and avoid filling up again on fluids before you have something to eat. If you're finding it easier to drink rather than food, then again go in for those higher calorie drinks, smoothies, nutritional supplement drinks, milk-based drinks, and fortified soups if you can. So nausea and sickness are very common, especially with chemotherapy. So it's that sort of unpleasant feeling in your stomach and your throat. You're usually provided with anti-sickness tablets through chemotherapy, and if you do have any radiotherapy as your treatment. And it's all about getting those tablets right. The first ones that you get given may not be the right ones for you. It might take a while for us to find the right ones for you, or you may need a combination of a few. But that can make a big difference to settling the nausea and the sickness, and then how much you can eat and manage diet-wise. An empty stomach can often make the feeling of nausea worse, so just try and pick at food little and often through the day and eat in small amounts. Plain foods are often better tolerated because they carry sort of less smell, so carbohydrate based, and Rachel's already talked about your carbohydrates, so your toast, bread, biscuits, pasta, rice, that sort of thing. Some people say that cold foods are better, so yogurts, creme caramel, mousse, ice cream, that sort of thing. And it's really useful if you can get somebody to cook for you, or sort of rely on more ready meals when you're feeling nauseous, as we often find that it can exacerbate nausea and sickness when you're having to cook for yourself and spend a lot of time in the kitchen. Sip on cold fizzy drinks between meals, that can sometimes help. And again, going for those nourishing drinks where you can. Some people find salty foods quite helpful when they're feeling a bit nauseous or sick, but I'd say that's quite individualised, works for some people and doesn't work for others. Try and avoid those greasy, fatty foods, you know, takeaways when you're feeling a little bit sick, and spicy foods and strong sort of smells as well can make nausea worse. And the old remedy ginger does work for quite a few people, so it's worth a try. So sort of snacking on ginger biscuits or sipping ginger ale, ginger beer or ginger tea can sometimes be quite useful. So sore mouth is a big one for a lot of people on chemotherapy. It's usually treatment related, but it's important to get your mouth checked as well, because sometimes oral thrush can arise and that can make your mouth and throat quite sore. If you're finding your mouth quite sore, some people find sipping with a straw better. Try and go for soft, moist, bland foods. Use lots of sauces and gravy with your foods just to make it nice and soft so it slips down easier. And on the flip side, avoiding sort of rough and dry foods like nuts, muesli and bread. Cold foods again can be quite soothing, or ice cubes, ice lollies, frozen fruit. But if you're wanting to go for frozen options, try not to pick fruits that are quite acidic, because they might sting or aggravate. So going for more things like pear, mango, apple type flavours. Again, we've touched on citrus fruits and avoiding them, and sometimes tomato-based sauces can sting a little bit as well. And the same with sort of chili, curry and different seasonings. Dry mouth, similar sort of strategies to sore mouth really, but it's important that you maintain your good oral hygiene, teeth brushing, keeping your mouth clean. Some people find chewing on gum or sucking on sweets helps, because it starts to stimulate the saliva in your mouth a bit more. And also some people find rinsing their mouth before meals with like a flavoured water or sparkling water can sometimes help and make it feel less dry. There are artificial salivas that can be prescribed, so it's worth speaking to your specialist nurse if you're really suffering with a dry mouth, and that's sort of one of your biggest issues. You know, there are a few that are available. So I'd say this is one of the most common side effects I come across in clinic, and the reason for you know, patients struggling with their oral intake. Taste and smell changes are difficult to deal with, because as with other sort of side effects of treatments, you know, there's medications for them, whereas we haven't got any medications to manage taste and smell changes. You know, and dealing with these changes requires a lot of sort of patience and willingness to try new foods as well. We often find that these changes change over time, so you might have, you know, you might be sensitive to sort of sweet foods at some point in your treatment, but we often find a couple of weeks down the line or months down the line that's changed and you've gone the sort of opposite way. So it's important to keep trying different foods at different intervals. Cold foods are sometimes a bit more better tolerated and they carry less smell. And, you know, go for foods that you enjoy as much as you can, but also trying new foods as well. We often see and hear patients saying, well, I've never eaten that before, but actually I quite like it now through treatment. So it's just trying new foods there. Food presentation can help, and the way it's presented on the plate. And again, monitor your mouth and tongue for any sort of thrush, as that can exacerbate taste changes as well. And that is something that's easily treated with medication. So foods taste bitter and metallic. This is a common taste change complaint. So strategies to help. So you could marinate meat in fruit juice or a fruity sauce to try and counteract that bitter taste. Try alternative protein sources to meat, as meat can often leave a bitter taste. So try fish, eggs, lentils, yogurt, cheeses as alternatives. Rinsing your mouth with a sparkling water or a fizzy fluid before eating. Some people try and use plastic utensils as opposed to metal. Works for some people, doesn't work for others, but that's worth a try. And sucking on sweet sort of lemon and lime sherbet, lemon, fizzy sweets between meals to reduce any bad tastes. Another sort of taste change that we hear of is a lot is that food just tastes bland. It just tastes like cardboard. So again, it's looking for your strong and sharp flavours, you know, using mustard, pepper, salt, spices, herbs, lemon juice, using sauces and marinades, sort of dressings like chutney, mustard, you know, balsamic vinegar there, just to try and enhance flavours as much as you can. Sharp flavours can also help because they tend to stimulate the saliva in your mouth. So lemon, grapefruit, lime, citrus, bitter lemon, them sort of sharp flavours might be quite useful. And foods that need a lot of chewing increase saliva production as well. And we often find warmer or hotter foods increase saliva, and you can detect flavours easily from them. Diarrhea, so this can be common after both surgery and chemotherapy. Surgery, obviously, because all of the digestive system's been rejigged a bit, and chemotherapy, the gut lining is irritated. You know, there are medications to help with diarrhea, such as sort of Imodium or loperamide, and you might find that following chemotherapy, you know, the diarrhea follows a pattern. It might be for a few days and then it settles down, or it may be that you're fine for the first week and then you get it a week later, for instance. It's important to keep hydrated as much as you can. Frequent sips throughout the day. Sports drinks are quite useful, just to prevent you getting dehydrated. Keep eating little and often as much as you can. You might find limiting high fibre foods such as your beans, whole grains, raw fruit and veg better in managing the diarrhea, and greasy and very fatty foods during this time might upset your stomach a little bit. Citrus sweeteners and caffeine all stimulate the gut and can cause diarrhea sometimes as well if taken in excessive amounts. And the same with concentrated fruit juice, that can sometimes upset your bowels. But it's also important to keep an eye on your bowels, okay? So we need to make sure that you're not malabsorbing and it's not related to you underdosing or not taking enough of your pancreatic enzymes. So keep an eye on your bowels. Let your healthcare professional, your specialist nurse, dietitian, oncologist know if you're having diarrhea, and then we can sort of assess and review whether it's sort of treatment related or related to your pancreatic enzymes. So fatigue and sort of exhaustion is another big side effect with cancer. It's a lot to deal with having a diagnosis itself, but then coming for treatment frequently can also make you very fatigued. It can impact on your weight and how much you eat, because you often haven't got the energy to go out or do any shopping or, cook. So ask friends and family to do shopping and cooking as much as you can. Lots of supermarkets do online food deliveries now, so it's making most of them, or using meal services such as Wiltshire Farm Foods or Oak House, where they will deliver ready meals to your door. Prepare meals and batch cook when you have got the energy, and freeze portions, and then when you are feeling a bit under the weather or unwell, then you've got something ready and prepared to eat. And if you are really tired and really can't fancy anything or don't fancy anything, then make use of nutritional supplement drinks if you have those, or sort of smoothies, milky drinks. A little bit of exercise can help manage fatigue as well, and it might help with your appetite. So just do a little bit where you can, even if it's walking up and down the stairs a few times a day, or just walking around the block, it all helps.
Hi Lauren, sorry to interrupt, just to let you know that we've got about 5 minutes until the Q&A.
Lovely, that's fine, thank you.
Great.
So, food and eating has a different meaning for everybody. For many it's a social activity, and we often hear, in clinic, about a lot of sort of pressure from family and friends about eating enough, concerns about not eating enough. It's important to do what you can, set realistic goals. Even if you're just eating a little bit more than usual, that's a great achievement. Gentle support and encouragement from family and friends can help as well. you know, without overdoing it, as it can often turn people the other way with food then, and take advantage of those good days with food. So we've just listed some recipe resources there for you. Okay, and swiftly moving on. So we often hear quite a few myths regarding diet, and patients coming into clinic, you know, with different sort of diet myths and whether they're true or not. Sugar feeds cancer is a common one that we hear all the time. So this is a myth. Okay, so we need carbohydrates in our body and for energy, and they're broken down into simple sugars and absorbed by our body. So cancer cells grow very fast compared to healthy cells and have a higher demand for fuel and energy, which appears to feed the cancer. However, if you're cutting out sugar in our diet, you're not restricting sugar to cancer cells, because our healthy cells need sugar as well, and they will find sugar from elsewhere. So that's where sort of muscle breakdown comes in, and using fat source to get that fuel. So please don't avoid or restrict sugar in your diet, and have it as part of a balanced diet. So I should only eat organic fruit and veg, as pesticides used in non-organic foods increase cancer risk. So again, this is a myth. Organic fruit and veg tend to use fewer pesticides. Very, very high levels of pesticides might cause cancer in animals, but we use a lot lower doses of pesticides, and there's no evidence that ingesting these small amounts of pesticides increase cancer risk. So Rachel did a quick Google a while ago, looking at sort of supplements and what patients were taking to try and manage pancreatic cancer, and these were some of the supplements that she found. There's no evidence at all that they sort of reduce cancer risk or help to tackle cancer. These are the sort of supplements that we found online, and actually they come with a very hefty price tag as well. So if you were taking all them, it would come to £135 per month, which if you look at it per year, is a massive amount of 1,620. So there's no evidence at all these supplements provide any benefit, and actually they may interfere with your chemotherapy or your cancer treatment. Other supplements as well, sort of high dose antioxidants, might help prevent cell damage, but again, they can stop chemotherapies working. So it's important you check with your oncology team before considering those. So, you know, while the internet can be very useful, it's important to discuss any sort of queries or supplements or anything you've read with your oncologist and your team. So there's some more useful links here for you, and you'll have access to these slides as well once we're finished tonight. So in conclusion, from Rachel's slides and myself, malabsorption can cause malnutrition. If we can get malabsorption corrected by taking PERT and your creon or your pancreatic enzymes correct, then we can optimize your absorption of your food and try and tackle, you know, the risk of malnutrition. Dietary restriction is not appropriate at all in patients that are malnourished or at risk of malnutrition, and using adequate enzymes and the right amount, as well as a nourishing diet, can help with your weight, cancer treatment, tolerance, and your overall well-being. And try different strategies that we've talked about tonight to try and manage side effects that you may have from treatment, and obviously use reputable information sources where you can. Thank you very much. I hope we stuck to time.
Oh, thanks, ladies. Rachel and Lauren, that's great. Gosh, there's so much information there, and I'm aware that for people watching, listening in, it's possibly quite a lot to be able to take on board. So as we said at the beginning, this video and the slides will all be available via our website, so either later tonight or tomorrow. So please feel free to have another look at that. We've got a few questions in the box, so that's great, thank you. May I just say that we do have some people who might be joining by phone today. So if you are joining by phone and you wish to ask questions, what you'll need to do is raise your hand on your phone by pressing *9, and then you'll be prompted to unmute yourself and speak. So what I might do is just go through some of the questions that have been posted already, and then we can perhaps come to anyone who's joining in by phone. There's a little bit of a theme to some of these questions, so I might start off with some of the simple ones actually, and then link up some of the others together. So one of the first questions is, are there any rules around taking PERT with alcohol?
I'm happy to take that. It would depend usually on what alcohol you're drinking. What I would say is if you're drinking something like wine or whiskey or beer, anything that's not milky, then it should be fine without PERT. If you are having something that's more creamy, like an Irish cream, like Bailey's or the equivalent that you can buy in the supermarket, then I'd probably treat that as a snack, or maybe just take 1 or 2 capsules with your PERT, with your creamy alcoholic drink. But what I would say is just maybe speak with your consultant or with your oncologist just about whether PERT is okay with your other alcohol is okay with your other medications and your other treatment.
Great, thanks, Rachel. Another really quick one. I drink oat and almond milk. Is this in order, and do I require PERT like I do with dairy milk?
Again, I can take this one. What I would say is dairy milk is probably going to be a little bit more nourishing. But if you're choosing not to have it for whatever reason, then of course you can choose alternatives. Try and go for the enriched version, so they're enriched with calcium as well. What I would say is oat milk has probably got a little bit more protein in than your almond milk, and remember, we're trying to get as much protein in as possible. So I'd encourage you to choose this maybe more than the almond milk, and then maybe think about if you need to fortify it with it. So could you add, skim milk powder, or could you add another source of protein from our presentation that we just discussed earlier to get those extra calories in, because it won't be quite as nourishing as dairy milk.
Thanks, Rachel. And another quick one. Shouldn't you take PERT with bananas?
I'll answer this one. There's always a bit of debate about the bananas and creon situation. So although they're a fruit, and we do advise you don't need creon or PERT if you're taking fruit alone as a snack, bananas are quite starchy. So what we tend to recommend in our clinics is taking 1 capsule of your PERT with a banana. Obviously, if you're having that as part of a pudding, for instance, with cream or ice cream, then you would need more PERT with that, and go off your sort of snack or pudding dose that you've been recommended.
Great, thanks, Lauren. Another couple of quick ones. Someone's asked whole milk or semi-skimmed milk, which one is better for pancreatic cancer patients?
I'll go if you want, Rach. So full fat milk ideally is better. So calorie wise, it has more calories per mil, 100 mil. So if you can go for full fat milk and tolerate that, that's better. Protein wise, protein is similar in both. Again, if you can't tolerate full fat milk, think about what Rachel's saying about adding skim milk powder, for instance, to fortify it a little bit more. Okay.
And on a similar vein, is whey protein good instead of powdered milk?
Lauren?
Yeah, it just depends on how much you have in whey protein wise, really. We'd need to make sure that you're meeting your protein needs without exceeding to a dangerous level. So it depends on how much you're having, but it is a useful alternative if you don't want skimmed milk powder, but you'd need to discuss it with a dietitian really as to how much you're having, just to make sure.
Great, thank you. I've got quite a few questions about from people who've had Whipple, so what I might try to do is join some of those together. So I'll just, if you think your question's not been asked, it will be. Just trying to sift through some of the others first. Gosh, there's one here. I'm a female, 61, and had my gallbladder removed at 59. So far, I have not developed diabetes. Am I at more risk of developing pancreatic cancer? Not sure whether either of you wish to answer that, or I could perhaps answer that if you feel not able.
Yeah, I think that's probably more your remit.
Yeah. Gosh, thanks for the question. We can't say exactly what your risk is. There is some evidence, but it's not widely known evidence that suggests that people with pancreatic cancer, they may have actually had gallbladder surgery before, but that doesn't necessarily mean it increases your risk. And that might be something that if you're concerned or if you're having symptoms, you might wish to call us on the support line and we can talk to you individually about that. I think as this is more of a nutrition session, it's possibly not so easy to answer, so hopefully that's helpful. Oh, just another one. So someone diagnosed with locally advanced cancer, do I need to take Creon for every snack as well as meals?
Yeah, we'd say any meals, any snacks that you're having, even if there's something that's quite small, if it's still quite nourishing. So for example, a yogurt, I would still take your PERT capsules with these snacks. The only thing you shouldn't really be taking it with is if it's you know, a single portion of fruit or veg on its own with nothing else, or something that's sugary like jelly, for example. But anything else, I'd always err on the side of caution and always take your PERT capsules just to get those nutrients absorbed really well. Okay, thank you.
This one's diabetic. So Jan 2, 6 years post Whipple's, talking about type 3C diabetes and carb selection. When you see on a packet X amount of carbohydrates, of which X amount of sugars, does the sugar value matter?
Yes and no.
Yeah, so I mean, I can start with this and then you can add anything extra in, Lauren. So you've got essentially two types of carbs. You've got your starchy carbs and then you've got your sugars. And then on your labels, the carbohydrates will it will be both sugars combined, sugars from your starches and sugars from your other sugars. You've also got kind of added sugars. So you have naturally occurring sugars in things like milk and yogurt, and then added sugars. So that would be things like table sugar or the sugar that's found in chocolate bars or biscuits, for example. It's difficult to say whether it matters or not. It can be a useful tool, but what I would say is if you are eating well, you are well nourished, your weight is nice and steady, and your blood sugars are fine, then, you know, being aware of not having too many of the added sugars, so not adding lots and lots of extra sugar or not choosing something that's got a high amount of sugar in it is probably sensible. If you are more towards the malnourished end, it might be useful to add these sugars in if it's the only thing that you can manage, but also making sure that your blood sugar levels are okay with your medication. Does that make sense?
Yeah, and it's prioritizing really, isn't it? You know, as Rachel said, if you're struggling with your weight and you are malnourished or at that increased, you know, risk, and you're not eating that well, you know, prioritize, you know, sort of ensuring that you're eating well and a nourishing diet, including sugars. But if things are okay and quite stable, and you're maintaining your weight and your blood sugars are fine, then you're probably doing everything that you need to, right?
Okay, we might move on to some of the questions, most of them relating to Whipple surgery. So I've had a full Whipple, which includes obviously lower half of my stomach, duodenum, gallbladder, bile duct removed. I have to eat little and often to get enough food in me during the day. I try to eat around every 2 hours. Recently, I've been losing weight. All my CT scans are clear. Any tips on food to gain weight? I'm currently awaiting assessment as to whether I may have type 3C diabetes.
Third one, Rach?
Yeah, I can go, yeah. Yeah, I mean, so eating little and often is obviously really helpful, especially if you're getting full quite quickly, which we can often see with that type of surgery. Yeah, I mean, think about the side effects, the symptoms of high blood sugars. So I know you said you're awaiting assessment for your type 3C diabetes, but that would be interesting to know what's going on with your blood sugars there. If you are eating well, but are losing weight, maybe have a think about what's going on with your PERT dose. Is your PERT dose effective? Are you taking enough of your PERT capsules? And what we can see is that sometimes when someone started on PERT, a certain dose is fine, but actually over time they might need to increase the amount that you're having. So you might need to review the amount of PERT that you're taking. So think about that as well. And then in terms of the tips on foods to gain weight, so if you try with the food enrichment strategy, so choosing your full fat foods, adding the calories and protein wherever you can, so choosing things like skim milk powder, adding in things like double cream or ground nuts to things like your porridge or any puddings to get extra calories and extra protein into what you are managing. And then if you are still struggling, then it might be worth speaking with either your GP or your specialist nurse about whether you could have some nutritional supplement drinks, which are extremely nourishing, often in quite a small volume, so they don't fill you up too much. And that can actually help just to get those extra calories and protein in if you can't get it in with food. One more thing, the British Dietetic Association have a really useful food fact sheet that you can access and print out on malnutrition, and that will give you a bit more information and more tips on enriching or fortifying your food. So I'd suggest going to hunt that out as well, and then you can use that daily to try and get your weight back on.
Great, thanks, Rachel. Another Whipple's question. Had a full Whipple 2 years ago. I get little or no notice of needing the toilet approximately every 10 to 14 days with extremely runny stools. Can't seem to pin down anything in my diet that would cause this. Is this common, and any ideas?
Yeah, I mean, I'm not sure if you're on chemotherapy or treatment at all at the moment. If your Whipples was about 2 years ago now. Sometimes with Whipples you can get something called dumping syndrome as well. So what can happen is sort of nutrients and the food can sort of pass through the gut very, very quickly and hit your small bowel, and that can sometimes cause sort of diarrhea and sort of urgency to go to the toilet. So it might be worth speaking to your sort of surgical specialist team or your GP if you're struggling with that. Again, thinking about your PERT doses as well. Are you taking enough enzymes now? You know, it may be that your dose needs reviewing and increasing. So it's looking at that as well. Have you got anything else, Rach, to add?
No, sounds good.
Okay, thank you. Another Whipple's question. I'm a few years after Whipple's, and the past few weeks starting to get intense pain like I had prior to surgery, all around my middle and back, lasting several minutes. I take plenty of PERT. Any advice?
I'm not sure that's within my remit. What I would have said is make sure that you're taking enough of the PERT, where it sounds like that you have thought about that already. So it might be worth Di answering this if you can.
Yeah, thanks, Rachel.
Thank you.
Certainly, what we would normally suggest is perhaps have you had a follow-up with your team? Is there any regular pattern with your symptoms, and maybe speaking to your surgical team? But it also might be worth you coming back to the support line and having a conversation with us as well. We'd be more than happy to talk through that with you in more depth if that's helpful. My next question. What foods can you take if you've had a stent inserted? And it doesn't say whether this is a biliary stent or a duodenal stent. The foods suggested appear to contradict what you can have during the presentation. So I'm assuming perhaps this might be a duodenal stent. Either of you?
Well, I think you'll probably see more stents than I will, won't you, Lauren?
Yeah, I mean, we don't place the stents at Clatterbridge. They tend to be done at the bigger hospitals. So we don't usually see once they're done, but usually weeks down the line, they will come to myself and the team. I think from current advice is that you would follow sort of just a fluid diet for a couple of days post-stent, and then gradually build up to sort of mushy soft diet, and then back onto a normal diet as tolerated. I think with specific foods, it's just being careful with sort of nuts, seeds, foods with pips, you know, sort of your fruits, being careful with sort of gristly and you know, fatty meats as well, so cutting that off, rind on bacon, for instance, or and you know, veg like sweet corn and peas we would generally get you to avoid, or mash down well and having a sauce, just to sort of avoid any, you know, sort of major blockages, and washing your you know, food down well with drinks after meals as well. But you can usually generally manage and tolerate, you know, a normal diet while it's just being aware of specific foods.
Things that are quite stringy as well, veggies that are quite stringy, so like celery or green beans that are quite stringy, they might be a little bit problematic, but yeah, generally it's you can make your way towards a generally normal diet.
Great, thanks, ladies. My next question, I'm due to have a distal pancreatectomy and my gallbladder removed. Does the removal of the gallbladder increase my risk or my chances of diabetes? I think you'd find that having your gallbladder removed doesn't increase your risk of having diabetes, actually. So again, I think please feel free to contact us on the support line if you've got any questions, but I'm not aware that having your gallbladder removed increases your risk of diabetes.
With that surgery, though, with it being a distal pancreatectomy, that end of the pancreas, that will be where the hormones are made that manage your blood sugar levels. So you might see, rather than the gallbladder being an issue and developing the diabetes, it might be the surgery itself that will put you at higher risk of developing that type 3C diabetes, I think.
Thanks, Rachel. Gosh, another Whipple surgery question. A gentleman who hasn't had any dietitian support after his Whipples, but has managed with some input from nurses, which he's benefited from, to treat his malabsorption. He's asking, how can I begin with some advice or guide to diet and developing a relationship with a dietitian? So I guess the answer is, for those people who don't have access to a dietitian, how can they actually take this step forward?
Yeah, so your specialist nurse will probably be able to refer you to a dietitian, whether it be hospital-based or community, and your GP is also another port of call as well, so they can make onward referrals to dietetics teams. But usually there are dietitians within a hospital that you're sort of attached to.
Great, thanks, Lauren. A question about, can patients eat fried food? That probably might have come up in your presentation, but is there a quick answer?
Can you eat fried foods? Yes, absolutely. If you enjoy them, I'd say absolutely go for it. You know, if it's foods that you like, eat regardless of whether they're fried, they're going to be giving you calories that you might not get from unfried food. So that's always a bonus. Just remember to take your PERT with whatever you're eating. If you're having something that is fried, so for example, you're having fish and chips on a Friday, something that is very fatty, it just might need an extra couple of your PERT capsules. And it's absolutely fine for you to dose adjust depending on whatever you're eating. What I try and do is empower patients to manage their dose appropriately to whatever they're eating. So things like fish and chips, it's going to be high in fat. So enjoy it, have it, just take a couple of extra of your PERT tablets.
Great. We've got two questions here. I'll perhaps join together. One is, would 10,000 Creon be adequate for snacks? Currently I'm taking 25. And do we need to take Creon with a chocolate snack? There aren't many nutrients in a chocolate bar.
I think though 10,000 units will probably be okay if you don't need to take lots of them with each of your snacks. So if you're having a snack and you would only be taking, for example, 2 of the 10,000 unit capsules and you're not getting symptoms of malabsorption, then it's adequate for you. It's just more of you not having to take lots and lots of extra capsules. So if you're fine with your 10,000, just make sure that you're taking enough to make sure you're not getting any symptoms of malabsorption. But yes, it's absolutely fine in theory. And do we need to take Creon with a chocolate snack? There aren't many nutrients. So with things like chocolate, even though they wouldn't be called, healthy, they've still got lots of calories in there. So lots of fat in there, and fat's really, really, really good for getting lots of calories in and helping to build our strength. And we want to be able to absorb all of the fat that's in there because it's really good for us. So yes, absolutely. Take your Creon with your chocolate bar and make sure that you're absorbing all those nutrients, and so it can be used. But also, if you're taking something like a fatty snack like chocolate, what you might see is that you get symptoms of malabsorption if you don't take your PERT, which can be really unpleasant. So I would definitely take it.
Thanks, Rachel. Next question. My poo occasionally floats. Could this mean I didn't have enough Creon for meal fatter than usual?
Yes, yeah, most definitely. So think about those signs of malabsorption and steatorrhea. So Rachel mentioned the fatty, the greasy, the oily stools that don't flush. So they're signs that you're not taking enough PERT. So in that case, you would need to increase your PERT by an extra 1 or 2 capsules with that particular meal next time.
Next one, if I don't finish or eat much of my meal and have already taken all of my Creon, does this matter?
No, I wouldn't worry too much about it. If you know, it's fine. You can't overdose on the amount that you're having. So I wouldn't worry. What I might say is if you can spread it throughout your meal, it might just help you it might help in terms of you being able to finish the amount that you're eating, perhaps, because you've got the PERT there to help you to absorb and break down your food properly. So you could spread it throughout whatever you're eating, but no, it shouldn't have an impact.
Thanks, Rachel. Next question, I'm vegan and not able to eat many of the advised foods. Any suggestions for food that I could eat?
Yeah, I mean, you know, it's you know, without having a proper discussion about what sort of food you tend to go for, you know, think about, you know, those sort of non-meat alternatives, you know, your lentils, chickpeas, your baked beans, but also there are some nutritional supplement drinks now. There aren't many, but there is a couple that are vegan friendly on the market now, so they may be an option if you are struggling with your appetite and your weight.
Thanks, Lauren. Gosh, I think, do all pancreatic cancer patients need to take PERT even when they eat reasonably well? Sorry, I might have missed this during the presentation.
Yeah, what we would recommend is that you do take PERT if you have a diagnosis of pancreatic cancer, even if you're eating well. What we want to do is make sure that you are absorbing all of the nutrients that you're eating. And often we don't see those symptoms of malabsorption until quite late on. So what I would say is, yes, take your PERT even if you are eating well, because that will help to maintain your strength and kind of stop malnutrition in its tracks.
Thanks, Rachel. Next question, I've forgotten my enzymes before when going out for meals, so I didn't end up eating as I was so worried. Do you think it would be okay to risk eating and taking enzymes when I get home, or is that too late?
It's probably going to be too late. So going back to what Rachel was saying before, so you need to be taking your enzymes with your food so they mix well, and you know, your food is digested and absorbed by the body. So, you know, if it's sort of 30 or 40 minutes later, then and you've not taken them, then, you know, we wouldn't worry about taking them then. Ideally, if you can remember to, you know, to take your enzymes with you, that's ideal, really. Yeah, it's a bit too late when you get home afterwards.
Thanks, Lauren. Again, this is a post-Whipple's question. My family have suggested I try and eat more in an attempt to gain more weight, but with only half a stomach left, I cannot eat much as I soon feel full. Any advice or tips?
Yeah, so it's going back to that little and often approach and doing what you can, you know, so try and aim for something to eat every sort of 2 hours through the day, whether it be, you know, a little meal, snack or nutritional supplement. You know, you can only do what you do. You know, you've had major surgery and everything's, you know, altered, and all of your digestion and absorption's altered. So just stick to little and often, do what you can do and make the most out of, you know, the good days and the days and times you have the best sort of appetite and intake, really. And maybe think about supplement drinks, you know, if you're not already on them. It can be difficult to achieve lots of weight gain after the type of surgery that you've had, again related to how your body works digestion and absorption wise now, so try not to put pressure on yourself, you know, and try and have that discussion with your family as well if you can do.
I've just got 2 last questions. This one, how does lipase from fat cells work together with lipase from the pancreas? Does the pancreas work harder when lipase is not coming from the fat cells too?
I'm not sure that I really understand that question. The lipase would be coming from the pancreas, and the lipase will help to break down the fats. The other thing that helps to break down the fats is bile, and that's made in the liver but stored in the gallbladder, and that helps to kind of break up the fat a little bit and works with the lipase to get that fat broken down to be allowed to be absorbed by the rest of the bowel. Lipase wouldn't come from the fat cells, so it'd just be from the pancreas. Is there anything else that you want to add to that, Lauren?
No, I think from what I've understood of the question, that's, yeah.
Thank you.
Really.
And very last, this is not really a question, more of a helpful comment. Jenny's just said, I have a duodenal stent. I've spent 6 months navigating what works, doesn't work, with loads of help from you, a nutritionist at the hospital. Split green peas are a replacement for peas. So nothing found to replace sweet corn, lettuce or any leaf vegetable except blasting it with a blender. So it's not really a question, but hopes that is helpful for people with a duodenal stent. So thanks, Jenny.
Oh, thank you.
Oh, thank you, Jenny.
And thanks also for the questions and the presentations. So that really brings us to the end. I'd like to thank everyone for joining in tonight. Thank you for your questions. Especially thank you to Rachel and Lauren for their presentations and taking time out. We hope you found it useful. There will be an anonymous feedback survey at the end. We'd be really grateful if you're able to complete this just to give us your thoughts. Obviously, we use this feedback for our future events. Also, like we said, the slides and the video will be available on our website, so please feel free to have a look at this. You can scroll through it in your own time and perhaps write down things that are relevant for you as well. If there are any questions tonight that you have that were unanswered or things that you think of once you log out of this session, please feel free to be in touch with us. You can touch base with us on the support line. If it's something that's out of our realm, we can certainly direct you towards the dietitians as well. So thank you everyone for joining. We'll close now and say good night, and hopefully we'll see you again sometime soon. Thank you.
Thank you.
Thank you.